When is it time to call hospice?
Hospice should be called when a patient decides to stop undergoing treatments and procedures that are focused on the disease. Hospice care is focused on the patient. It's time to call hospice when the patient and the family have decided that they want to focus on pain and symptom management. Hospice is comfort care, and the focus is on keeping the patient as comfortable and as independent as possible while allowing them to live their best life, surrounded by family in the place they call home.
Does calling hospice mean I'm giving up?
Well, hospice is a Medicare benefit that patients have worked hard for their whole life. Hospice is the highest level of health care a patient can receive in their home, wherever they call home. The emphasis of hospice is to symptom manage and to keep patients physically and emotionally comfortable for as long as possible and enable them to continue with their normal activities. Studies have proven that patients that are qualified that come on hospice sooner have a better quality of life. So the question is asked, is hospice giving up? No. Hospice is living your best life when life matters most.
What is the purpose of hospice care?
The purpose of hospice is to provide clinical care that ensures comfort, safety, and quality of life for the remainder of life to patients who have been diagnosed with terminal illness. The philosophy of hospice is the management of symptoms rather than the treatment of the disease. Hospice is committed to honoring the greatest concerns of both the patients and the families at this time when life matters most.
Where is hospice care provided?
Routine hospice care is provided wherever the patient calls home, whether that's their personal residence or facility. Here at Family Hospice, we have a saying, let family take you home. We say this because we know how important it is to both the patient and the family to be in the place where they're the most comfortable. By bringing our care team to you, we can provide care to both the patient and their family.
How do you qualify for the hospice benefit?
A patient qualifies for the hospice benefit if they've been diagnosed with a terminal illness and it's now their wishes to receive comfort care in lieu of ongoing medical treatments and medical procedures, all focused on the disease. To be admitted to hospice, a patient needs two things. First, for a physician to write a hospice order, and secondly, for a trained hospice nurse to come and do a full evaluation. The hospice benefit is 100% covered by Medicare, and most private health insurance plans and most Medicaid plans have a hospice benefit. If you're not sure if your loved one or you qualifies for hospice, not to be concerned. Family Hospice is ready to help. We'll walk you through a few simple steps to determine your eligibility. It's our goal at Family Hospice that every qualified patient and their family would experience the full hospice benefit.
Why choose Family Hospice?
At Family Hospice, we understand that facing life-limiting illness is one of the greatest challenges that we face in our families. We know that because we personally, as individuals, have been through very similar experiences. In fact, it's a prerequisite for every member of our team that they have had an experience with hospice that had an impact on them. We often say that we have a calling to provide hospice care. Our intent is to provide the best service that we can, the most compassionate care that we can, because again, we've been through hospice just like you're going through it today. Our responsibility as leaders at Family Hospice is to support our staff that have this wonderful calling to provide hospice care. If you have a member of your family that could benefit for hospice, or you simply want to explore what the benefit offers, please reach out today and let family take you home.